Hey guys, it's Monica. You guys either have me as a hygienist or you've seen me kind of pop around the office, go into Doc's room and help him out, or Kelly's room, and I've either helped them out or I've taken some of their things from their room because I need them. So we're making this video mainly to discuss water picking, flossing, why it's important. Some of you may be watching this and you say, I don't need this. My teeth are bad. I was born with bad teeth, or my pregnancy, my baby took my vitamins from my teeth and that's why I have cavities. That's why I have gingivitis, things like that. That's not necessarily the case. No one is born with bad teeth. The biggest thing is you may be predisposed genetically, like say family history of periodontal disease, tooth loss, decay, things like that. That puts you more at risk, but it's up to you to make the appropriate, choices as far as, lifestyle, diet, home care, things like that. And the ball's in your court at that point. Are you more, likely to get things like that if we don't take care of it? Yes, but the goal is to be proactive. As far as pregnancy, your baby doesn't take your nutrients. What happens is your hormones, your hormones are going crazy at that time. So your body reacts differently to the bacteria that's in your plaque, which can cause a gingivitis, which can cause, more cavities. But as far as like nutrients leaving your teeth and creating soft teeth or things like that, that doesn't happen. That's not a thing. So when, typically with pregnancy, we want to see you more frequently. We want to see you every 3 months. We want to take care of that inflammation that's in your mouth because that translates to your whole body. So the biggest thing is your whole body health. It starts with your mouth. So it starts with what you put into it. It starts with how you treat it. The less inflammation in your mouth, the less inflammation people see in their joints, the less sugars you see when you get your A1C checked. If you're diabetic, things like that. So it's, in the end, it's up to you whether you want to be proactive or reactive. If you know you have a family history of periodontal disease, are you going to get yourself into the office? Or you're going to say, oh, my family has bad teeth, I'm just going to leave it and, whatever happens, happens. Or you go when you have an issue and the dentist recommends, scalings or root planings, crowns, crown lengthening, or seeing a periodontist, and you say, yes, yeah, I want to do it. Now I want to try and save my teeth. Or you say, no, I'm going to pull them all out eventually, one by one, which isn't ideal. We don't want the infection to linger in there, but we also want to try and save the teeth that we can. So in the end, it's up to you. It's what kind of how you want to invest in your health. If you're going to put yourself as a priority and get yourself going in the right direction. The first thing I do want to talk about is bacteria. So we'll start there and then get into some other stuff. And then we'll use some models and go over the brushing and the different water pick tips and stuff like that. And that's it. Then you're done hearing from me, and Miss Kelly will take over flossing, and I hope you guys are all staying safe. So when it comes to bacteria, there's kind of general terms, two types of bacteria. There's anaerobic and there's aerobic. The type that I want to focus on is the anaerobic. That one is the one that's found in your dental plaque. That type of bacteria, it doesn't need oxygen to survive. It doesn't need oxygen to grow. If anything, when oxygen is introduced, it does kill that bacteria. That type also, it thrives off of, a high carb diet. It likes its sweets, it likes its sugars. When that bacteria breaks down those sugars, then it creates acids. Those acids, that's what leaches that, the minerals from your teeth. It leaches, the calcium, it leaches the phosphorus. It's not good. It starts to cause cavities. That's when we start to see those like the white chalky lines. So people with braces, you can always see where they had the brackets, or you can see along some people's gum lines, it's like white, it's chalky, it looks a little rough. That enamel is breaking down. It's not sound enamel. My patients know I'll run my Explorer along the top and I'll have them hear and feel the difference of the sound enamel versus the enamel that is demineralized or decalcified. That's what we want to prevent. The process of bacteria multiplying and adhering, it happens within seconds of brushing. Plaque formation is already beginning. So even if you have a dry brush on hand, that's fine. As long as you're disrupting that formation, that's okay. The biggest thing too is when we prescribe toothpaste like the Prevident, or some people use Clinton Pro, some people use MI paste because they don't want to use fluoride, which is fine. you want to remove that bacteria effectively, because if you're just kind of putting that on there, going, you know, around real quick, and that plaque's still there, that toothpaste, it can't penetrate that tooth structure, and it can't remineralize those areas if you have something in the way, and that constant, you know, acid erosion, and it's going to cause a nice big cavity. And we don't want you to have fillings. We don't want you to see us for fillings. We don't, nothing like that. We want you to come in for your cleanings. We want you to be healthy. And that's the point. You just want to keep you in our room and not Doc's room. A lot of people ask where their tartar comes from. Why do they have tartar? Another name for it is calculus, which is what we normally use, but the more known term is tartar, so we'll just use that. It's hardened plaque, so it's plaque that's been missed. It only takes 48 hours for that plaque to harden, and several days for it to turn into tartar. And that's for us to remove. So the people who are using, you know, jewelry tools and their fingernails and stuff like that, stop doing that. You're gonna hurt your gums, and then we're gonna see all the cuts and scrapes, and it's just not a good time for anybody. So when we talk about removing plaque, that's when we start talking about, you know, brushing, flossing, water picking. The biggest thing, I'm going to start off with brushing. Stick with a soft bristle brush. I know a lot of you like, you know, medium and hard. You feel like soft isn't doing anything, but the hard is so abrasive. The medium and the hard are both so abrasive. You can cause, you know, recession, especially when you're in there and you're scrubbing really fast to get ready for work, or the kids are, you know, you're in a hurry with the kids. It's not good. You're going to cause more damage over time. You're going to wear in your enamel, and you're going to ruin your tissue attachment, which causes, you know, the recession, the long teeth, whatever you want to call it. The only time you should ever use a hard toothbrush is if you're cleaning grout in your tile or something, getting that dirt out of there. Otherwise, it shouldn't go anywhere. My boyfriend's a mechanic. He won't even use it on the throttle bodies because it ruins the metal. So imagine putting something like that in your mouth and the damage it can do over time. When it comes to what do I recommend? Do I recommend, you know, manual versus electric, or vice versa? I always say, you know, you go behind the science, and they do like electric versus the manual. Electric, the vibrations do remove more plaque than you know, a regular toothbrush will do. There's two kinds. You have the sonic, which is like a Sonicare, so it uses vibrations, or you have the Oral-B, which is oscillating. So they say, you know, quick back and forth, but it kind of moves in like a little clockwise movement. My preference, I've used all of them. I do feel like I get a better clean with the Oral-B. You know, they do say that the oscillating method does remove more plaque. You know, some people don't like it though. Some people, you know, prefer Sonicare over an Oral-B, and that's fine. As long as you're, you know, you're using it effectively, and you follow the directions that come with a toothbrush, you're fine. You know, my mom uses a Sonicare. I use an Oral-B. I clean her teeth. Her teeth are beautiful. I've had some people who use a manual toothbrush, and they, you know, you do it effectively and they look phenomenal. You can have the best toothbrush in the world, and you can still have plaque everywhere because you're not using it right. The biggest thing is learning how to use your toothbrush. So in the end, if, you know, electric isn't in the budget right now and you need to use a manual, take your time and learn how to do it the right way. If dexterity is an issue, say, you know, you've lost some of your fine motor skills, things like that, find a brush with a bigger handle, or stick a tennis ball on the bottom. That way you can get a better grab on it versus trying to, you know, use a toothbrush and you're not getting a good grip, or you're being too aggressive because you kind of need to use all your muscle to hold on to the toothbrush. Another thing too is, if you do decide to, you know, invest in your health and invest in a nice toothbrush, read up on it, read the reviews, see what people like, see what people say. Some people say, you know, the Oral-B is, you know, too aggressive, and other people think that the Sonicare is too soft, or it kind of depends. It depends on what you like and how you want to feel. I know a lot of the people that I see, you know, who were scrubbers in the past, or kind of getting away from the habit, they like the Oral-B because, you know, it gets in there, it gets it clean, and, you know, that's important to them. But in the end, it's kind of up to you if you want to invest in your health, if you can invest in your health at this time. If not, at least invest the time to learn how to do things appropriately, because you can brush, you know, 3 times a day, but if you're not doing it the right way, you're not doing yourself really any benefit. Are you getting rid of some plaque? Yes. but is there still some there that could, you know, linger and turn into a bigger issue? Definitely. So the goal is to get everyone, you know, on the same page and doing things the right way the first time. I guess another thing I want to say too is, if you do invest in a toothbrush, do one that you like and one that you're excited about. Don't do one that, you know, oh, so-and-so used this, it's great, or you, oh, my dentist, you know, pressured me into getting this, or whatever, however you feel. It's about you in the end. So, you know, if you're excited to get it, if you're excited, you know, about this product, you're more likely to use it and want to use it the right way versus, oh, they said I should use this, I use it like once a week because I have to. So we don't want any of that. We want you to be excited about, you know, taking care of yourself and taking the initiative to do something like that. You know, any habit that you have, it's tough to start. Any habit, it's tough to start, it's tough to keep. You know, what I see a lot is, I left my cleaning, I feel great, I'm gonna start flossing every day, and then I miss one day, and then I'm like, you know, I don't really need to do it anymore. And it's almost like the same thing when people say, oh, I'm going to start a diet. I'm going to start a diet Monday, no next Monday, no this next month, whatever. And it doesn't really happen. You're not doing yourself any benefit. Are you trying initially? Yeah. But if you don't stick with it, you're not helping yourself out. You know, if you have a goal, write it down. You're most likely to move forward with it if you do write it down. Leave yourself sticky notes, leave yourself floss on a TV stand or somewhere where you watch a show before bed. That way when you get to the bathroom and you're like, oh, I don't really want to do it, it's already done. You did it on the couch, you know? I don't know, little things, little tips like that will help a lot. So both the Sonicare and Oral-B have built-in 2-minute timers. Some of them may have like a whitening setting, things like that. That one, it's going to brush your teeth at different intervals, so you almost hear the vibrations and the sounds being a little bit different. And they also make you brush a little bit longer. So brushing longer is going to remove more stain. It doesn't necessarily like whiten your teeth though. So when you hear, like I'll press this little guy, you're going to hear a little tone change that tells you when to change to the next section. So basically you want to break your mouth into 4 areas. So from the back to the front, and then split it again from the back to the front, and then the same on the bottom. So you want to do cheek side, tongue side, chewing surface. After that 2 minutes is up, the brush will automatically shut off. I mean, I know there are some times where I've brushed my teeth and I spent 2 minutes on the top and I'm like, oh, I might as well just spend 2 minutes on the bottom. But it's a great little indicator to tell you, hey, you need to switch sides, or, oh, you really only spent, you know, that whole time on the cheek side, you should go back to that area and brush again. Get the tongue side, get the chewing side, and then move on to the next areas. The great things about these brushes is they do the work for you. So all you do is you start in the back, spend about 5 seconds per tooth, and then just drag it forward. You're not brushing back and forth. The work is done for you. So it's not like a manual toothbrush. So both the Sonicare and Oral-B have built-in 2-minute timers. Some of them may have like a whitening setting, things like that. That one, it's going to brush your teeth at different intervals, so you almost hear the vibrations and the sounds being a little bit different. And they also make you brush a little bit longer. So brushing longer is going to remove more stain. It doesn't necessarily like whiten your teeth though. So when you hear, like I'll press this little guy, you're going to hear a little tone change that tells you when to change to the next section. So basically you want to break your mouth into 4 areas. So from the back to the front, and then split it again from the back to the front, and then the same on the bottom. So you want to do cheek side, tongue side, chewing surface. After that 2 minutes is up, the brush will automatically shut off. I mean, I know there are some times where I've brushed my teeth and I spent 2 minutes on the top and I'm like, oh, I might as well just spend 2 minutes on the bottom. But it's a great little indicator to tell you, hey, you need to switch sides, or, oh, you really only spent, you know, that whole time on the cheek side, you should go back to that area and brush again. Get the tongue side, get the chewing side, and then move on to the next areas. The great things about these brushes is they do the work for you. So all you do is you start in the back, spend about 5 seconds per tooth, and then just drag it forward. You're not brushing back and forth. The work is done for you. So it's not like a manual toothbrush. When we're using a manual toothbrush, you want to place your toothbrush bristles right against your tooth structure and then angle up 45 degrees. You want to do small circles along the gum line so you're removing that plaque. These bristles get like 1 to 2 millimeters below the gum line, which is awesome. When it comes to kiddos though, kiddos and people who start to lose that dexterity, they want to do bigger circles. So you can do big circles everywhere. Try, if anything, and get the bristles up at the gum line and brush down for those top teeth, and on the bottom, angle downwards toward the gum line and brush up to scoop that plaque out of there. Kiddos who are like 3, 4, 5, they're not, they're not tying their shoes yet, anything like that. They don't have the dexterity to brush their own teeth. So please help them. They need the help. I know they say they have it. I know they say they can do it, but they can't. They don't have, the capability just yet, and they need your help. Another thing too, my people who are missing, a molar somewhere, this area right in here is called the edentulous area. So you might not have a toothbrush at home that, fits in that space. Your tooth has drifted forward and you can't fit a regular sized toothbrush in there. But you can always use a kid's toothbrush. You can always use a little interproximal brush, but for the sake, I have a kid's toothbrush. Just get in there, 45 degrees, do your circles, massage that tissue, especially for the people who have partial dentures where it clasps right in there. That packs in so much food and bacteria, and you want to get all of that out of there. Now, as far as electric toothbrushes, I have a Sonicare, so you can see when I press on, it'll vibrate side to side. It's very quiet. And then I have my Oral-B, where I turn on, and it has that little oscillating motion that we were talking about. This one does have a pressure sensor, so if you push too hard, it turns red, and it lets you know, hey, you know what, you're putting too much pressure when you're brushing. This guy, same idea. So against the tooth structure, 45 degrees, and you want to spend about 6 seconds per tooth, really contour that brush and those bristles right along that tooth structure, get in between the teeth. And same idea with your Sonicare. So Sonicare, nice and gentle, you can hear the difference. Angle right at the gum line. See, what I like about the Oral-B is you can really focus on one tooth at a time and really curve in there. But again, everyone has their preference. You find what works for you. As far as water picking goes, so I do have a lot of patients, especially my periodontal maintenance patients I recommend a water pick. Biggest reason being, like we were talking about before, that anaerobic bacteria cannot survive with oxygen. So we introduce that water and that oxygen with the water, obviously, into those deeper areas. The goal is to kill that bacteria. And we want to promote, tissue health, better attachment levels, less bleeding, less gingivitis, things like that. So when you use a water pick, it'll come typically with 7 different tips. They'll have like 3 regular tips, 1 orthodontic tip, toothbrush, plaque seeker, and an ortho brush. Sometimes they'll come with a tongue scraper, but usually it's additional. I have a preference. I do like the water pick Aquarius the best. That one, you have a dial from 0 to 10. It's a little bit more compact. And you also have a massage setting. So if you have any area that's irritating you, you can just massage that area with some pulsating water. Typically, you just use the warm water. I wouldn't, add salt water or anything. It can ruin the components and they won't give you your money back. You can add some mouthwash in there. You'd fill the basin 2 times with warm water. So the first time, you'll do the top. So you start in the back, you go around, and then you swivel and do the tongue side, fill it up again, and do the bottom. When you do that, depending on how your mouth is, if you have pockets, there's certain tips that I want you to use. If you have a deeper pocket, I want you to use the pickpocket tip. That one you angle 45 degrees into your gum tissue and irrigate deep in that pocket. If you are more like me, I don't have pockets, but I still like to keep, I don't want any bacteria in my mouth. I want to keep it as clean as possible. You angle that 90 degrees towards your gum line and trace along, and you pause in between each tooth. I have a little model, so I'll show you afterwards. My water pick, it's a little handheld one. I don't recommend it only because it only has a high and a low setting. The low setting doesn't really feel like it's doing anything, and the high setting is not the most comfortable thing in the world. So I'm going to be totally honest with you. So if you can, water pick Aquarius, they have them at Best Buy. They have them on Amazon. They're like 60, 70 bucks. And they work awesome. They work great. You can also go through the Waterpik website and read up on them before you decide to make a purchase, but I absolutely love them. So this is the Waterpik that I have. This is the one that I don't necessarily recommend because it only has that high and the low setting. The low doesn't feel like it's doing a whole lot, and the high is just pretty intense, so it's not so comfortable. The way you take the tip out in this one though is you press this little gray button. This pops out, pops right back in. They recommend replacing these every 3 months, just like your toothbrush heads. You clean these just like you would a Keurig too. You can do the bleach, vinegar, or whatever you're more comfortable with. This little tip, you can swivel 360 degrees. So if you need to get cheek side, you're good. And then so you're not bending your wrist and tilting, you can swivel this over to the tongue side. That's going to make your life so much easier. This little tip right here is that classic tip. This one is the one that you use, I'll use this little guy, 90-degree angle. And you go along and you pause, and then you go along again and you pause. You go right along the gum line and you pause in between each tooth. Same with the bottom, same along with the tongue side. And then I do have a couple more tips. I don't have all of them that come with the Waterpik. Some I've given to family members, especially my niece. She's in a bunch of ortho right now, so that's exciting. This one is an ortho tip. So this almost looks rubbery. It's actually little bristles. So these bristles will help get around the brackets. I did make a little makeshift bracket on my model with a staple and some wax, so that's exciting. I'm not crafty. So this one, you want to get around the bracket. You almost want to do a full circle around the bracket and then get along the gum line, just like you would the classic tip. Get along the gum line and pause. So you want to do circle, gum line, end to end. You want to get that whole structure. And then again, tongue side swivel, go along the tongue side. Some of my patients, I do want using a, what we call like a pickpocket tip. That one I do not have. It's similar to this, except it's tapered and it goes to, it's almost like a whitish in color. It's a tapered rubber tip. So just like when we check your probing measurements, and just like when I say angle your bristles 45 degrees to your gum line, you want to do just that. So for purposes, I'm gonna go like this. So what you say, you have a pocket right in here. You want to angle that toothbrush, that Waterpik tip, right between the teeth and blast that deeper pocket. That will help a ton. I do have one other tip. This one is called the Plaque Seeker. This one's really good for implants, crowns, bridges. It has little bristles. The water still shoots out dead center, and you can get underneath if you have like a little lip with a crown, or get a little bit, massage the tissue around the implant, things like that. It's nice and gentle, and it won't ruin your implant, any of your porcelain, ceramic work, things like that. It's great. When you're using the classic tip or the Plaque Seeker tip, as far as pressure wise, that's kind of up to your comfort level. I usually have people work up from like a 3 and go up from there. Some people stop at about a 5. Some people go to about a 10. Anytime you're angling that Waterpik tip, the pickpocket tip I should say, down below the gum line, you don't ever want to exceed a 10 or a 5 or anything like that. You want to stay at a very low pressure because too much pressure can damage that pocket. You want to keep that attachment healthy, but you also want to be safe about it. So you want almost like a gentle irrigation coming out of there. So remember to keep that pressure a lot lighter than anywhere else you would use in your mouth.